The Trust is a very large university hospital. It's about 1,000 beds in total between the adults and children's services that we provide across all of the subspecialties. The mobile point of care technology project that we've been doing is around the acutely deteriorating patient in the hospital setting, looking at identifying the patients earlier in order to provide patient safety benefits for them. The major patient safety benefits that we had were in a couple of different areas. We reduced the length of stay, which reduces the exposure of patients to hospital-associated infections, for example. We reduced the number of admissions to intensive care and the number of intensive care days that we used across the patient cohort. We also saw reductions in the cardiac arrest rate and the mortality rate, although we didn't actually power the trial to look at those areas, but we did observe them during the study period. Some of the biggest challenges during the deployment were, as you might expect, people and technology. The people problem was really just around the idea of change, and we overcame that really by an iterative process of education, reinforcement, really just tailoring the benefits to the clinicians and to the patients and reinforcing it. The advantage to using TrackLine was that they were able to source a number of different manufacturers to provide samples of kit for us to evaluate, and we're able to negotiate having a full understanding of what we're trying to do on our behalf in trying to get us the best equipment at the best price. We use a couple of different devices. We use a Hewlett-Packard iPack for going around the bedside, inputting the patient's observations, blood pressure and the like. We also use Panasonic Toughbooks in order to take round on the ward rounds to look at the patient observation charts. They're also computers in their own right, so we can do order comms on them to select bloods and look at results and request x-rays and the likes and view those if necessary too. If I was to give advice to other healthcare organisations about this kind of implementation, it would be to plan it properly, particularly with regards to education. The other thing is to pick your partners carefully in terms of providing equipment and evaluating equipment with a view to the future as much as you can. The benefit of the Mobile Point of Care conference today has really just been to see the experiences of other NHS providers and indeed private providers in implementing these kinds of projects for patient safety reasons. It's interesting to see that the same themes are coming out along the lines of winning over, using champions, and actually the issues are really around the human factors rather than necessarily the technology factors. But it's been a fascinating conference in